from the first answer, do we get to, yes, that feels useful? Because it could be something like as we move into laryngeal lateral type of movements, and whether we're doing laryngeal, a variation on laryngeal manipulation, or my version of let's slow down and explore one side and the other. We're looking to kind of match what we think we feel as the clinician with what they might be experiencing as the person, right? I remind them before I start any technique, the goal of this is not just to stretch things. The goal of this is to stretch things in a way that we start making maybe an impact. It feels useful. It feels like I'm bringing you close to why you're here in my room. And I tell them that each and every time. Even a patient who I've seen multiple times, I remind them that. So they just don't decide to lay back and let me do my thing, which is boring to me. I want this to be a partnership, not a dictatorship. Right? So as I lateralize, I remind them, now you talked about that feeling of difficulty when you try and swallow, and you pointed to an area in your throat, maybe right about in here, and I might say, am I close to that feeling that you described? There's the first question. And they might say, no, you don't quite have it. I'll say, okay, where do I need to go? And you can tell me, or maybe you can put your hand over mine to help me localize that. That invitation, some will take, some won't. I can't force them, but I try. I keep sort of pestering them. Show me, help me. Sometimes they'll come up, they'll adjust, and they'll immediately go away. Or sometimes they'll come up and linger for a bit. Sometimes they'll come up and never leave, and that's what I really like. So they're an integral part of what we're trying to accomplish. But we might say, they might come in and localize it. And I'll say, okay, when you do that, what do you feel? I get feedback. And they'll say, that sort of makes that swallowing a little bit more difficult right there. And I might ask, does that feel safe? Does that feel useful? Does this stretch feel like it might be helpful? And they might say, well, you're close, but you're not quite there. So let's get closer to it, right? Bring it to a place where you feel like, yes, right there. And that could mean they put focal pressure here, or begin to do some of the other things that I'm going to demonstrate in a few minutes. In order to get to a place where we go from, I'm not quite sure, to boom, right there. My questions continue until we get to, yeah, I think that feels good right there, or no, we're just not finding it, all right? The questions we're making them up as we go along based on what the patient says to us. I'll hear people asking questions like, well, how do you feel? And the patient will say, fine. And you really didn't get anywhere with that question. How do you feel? I like, what do you feel? That describes more their experience in that moment. But you're going to hear me make mistakes all the time with my questioning. Or I'll ask to close in the question, yes or no. But then I'll open the question up right after that. Does this hurt? No. Okay, good. What do you feel? Does it feel like we're connecting with your issue? I talked in the back yesterday about needing to work on your vocabulary. That sometimes when I ask somebody, does that feel familiar? Or does it connect to your issue? They look at me like I've asked them the dumbest question in the world. I don't know what you're asking me. So I have to try different vocabulary to get closer to what we're looking for. Right now, you describe that problem when you eat. Right now, are you feeling any of that? Does it feel like this is replicating that feeling? I'll sort of fire a lot of different words and phrases until something makes this light up and say, oh, I get it, and then I'll stick with that word or phrase. All right? The goal with what we're doing with our hands is not just to stretch things. It's to localize something that they can relate to. That's the key. Questions on the dialoguing piece?